sounding good. My name is Annette Steffenhauer. I'm the legal director for Washington State Healthcare Authority. I specifically have been with the Medicaid agency in Washington State since 2003. When Medicaid transferred over to the Healthcare Authority in 2011, I joined this team. And I'm very glad to be able to be here today with you to help facilitate some conversation around the Drug Price Transparency Act implementation at the Healthcare Authority. Today I'm going to give you some information, to share some information. It's not going to be a lot of new information. It's what you've seen in the law that passed. My real goal for today is I want to hear from you. As we're building, designing, and implementing, we want to be sure that we have your input, understand the constraints that your organizations as drug manufacturers might have. So today's audience, we invited specifically drug manufacturers to attend. We're doing 3 stakeholder sessions with some others that are impacted by the legislation that passed last year. However, this is an open meeting, so anybody's welcome to attend. With that, I think we'll hit close on that back door and get rocking and rolling with the slide deck, and then have an opportunity for you guys to share some information with us, for us to know so we can implement this well, okay? Thank you, Jason. Next slide. All right, so welcome and introduction. Welcome. I hope you feel welcome. That's our goal, right? I think we've done some introductions. Some logistics. So today's webinar is being audio recorded. So although it looks like we only have a few people in presence today, we've got quite a few people who are joining us remotely via the webinar option. At the listening session, we're going to be soliciting information from you as well as the attendees who are streaming us right now. If there is a natural disaster or an issue that happens here that we need to evacuate the building, just follow me. I will take you safely out of the building. I had facilities for 1 year. I can do that, okay? Right? Okay? Other than that, there are restrooms and facilities if you need them out in the foyer out there. So go ahead and help yourself. Now, if you have some planned comments today that your company wanted you to share and you wanted to make sure you got on the list, we have a sign-up sheet back there. And you can put your name, your organization, and we'll be sure to dedicate time for you. However, you don't have to do that to be able to speak. We will also have an open mic time. There's a mic that can go around the room. Everything is being auto-recorded so that we don't lose your information. I don't want to spend time today taking notes. I want to hear what you have to say. I want to learn, and I want to use that information. So it is audio-recorded. Does anybody have any questions so far? Yes.
Will it be able to have someone else listen to this later? I mean, it's being recorded, but is it going to be somewhere where we could access it?
That's a great question. So for those who couldn't hear it, we have mics up here that most folks in the front of the room, they're going to get captured on the webinar from the mics right there. So I think the folks in the webinar probably heard you. The folks in the back of the room don't have as well of a mic connection, and we have a free mic. I'm going to restate it though, just to make sure nobody on the webinar missed it. And the question is whether or not we're going to make the auto recording or some sort of tool available so other people can view it. I'm going to defer over to Archie and Arlita.
Yeah, we can convert it into a YouTube and post it on the website.
Fantastic.
Yeah.
Thank you.
Yep. So for those on the webinar, the answer is yes. We will make sure that it's available for you. Any other questions before we get started? Let's see. Agenda review. Let's go to it next. Slide, please. It's pretty simple. I'm going to tell you a little bit about the Drug Price Transparency Program overview. It's going to be what you saw in the bill that passed last year. No surprises. I didn't paraphrase things. That's me. So I'm trying to get things done, that's fine. But you shouldn't see anything new that you haven't seen if you haven't read 1224 last year, okay? I'm going to share with you our rulemaking schedule. Part of my portfolio is all contracting, procurement, and rulemaking for the agency. So we're going to share with you the timelines that you want to be aware of as we go through the rulemaking process. Then the most important part for me is I want to hear from you. So it's a listening session. I want to know what you think. So it's an opportunity for you to share some feedback with me. And then the last part of the presentation, our slide deck, is just a reminder on how to sign up for rulemaking notices so you can stay informed for your organization. Any questions on that?
Annette, just to interrupt, can people on the phone please put into the question page if you can hear us? I have a note from one person that said they can't hear. So please answer again if you can hear us.
Can you hear us?
Okay. So yes, it's a little muffled. Okay, we're going to try to speak right into the mic. Yeah.
All right. Sorry it's a little loud. I'm told that I'm loud anyway, so I don't usually require a mic. So I'm trying to temper myself. Next slide. So this is just starting the overview. I assume that you already know this information. That's why you're here. But we're going to go through it again. The words on the slide to make you for data from the law. It might be Annette paraphrasing as the great legal director of the Washington State Healthcare University. Either way, it works, right? Let's go. So the overview of the program, Chapter 43, 71C RCW directs us to implement this program. And it's a drug cost transparency program through reporting from health carriers, pharmacy benefit managers, drug manufacturers, and pharmacy service administrative organizations. Next slide. In the bill, in the law, the legislative findings was that the Washington State has a public interest in the price and cost of prescription drugs, in providing notice and disclosure of information relating to the cost and pricing, and to provide accountability to the state for prescription drug pricing. It has a public interest in the rising cost of drugs and consumers' ability to access those drugs and containing prescription drug costs. Next slide. So who does this apply to? Well, covered manufacturers, that's a term of art. We'll be talking about that a little bit today. You'll find it in the RCW. Health plans and carriers, pharmacy benefit managers, and pharmacy services administrative organizations. Next slide. So under the law, a covered manufacturer is defined as a person, a corporation, or other entity engaged in the manufacture of prescription drugs sold in or into Washington State. It does not include a private label distributor or retail pharmacy that sells drugs under the retail pharmacy store or a prescription drug repackage. Next slide. A prescription drug is defined in the law, so I'm not going to be making up a regulation to redefine that. So the next few slides are going to be similar in that. These are the definitions, so that you'll see throughout as we implement this program. So prescription drug is a drug regulated under Chapter 6941 or 6950 RCW, including generic, brand name, specialty, and biologic products that are prescribed for outpatient use and distributed in a retail setting. Next slide. Covered drug is an important term of art, and so I just wanted to spend a few minutes to share what the law says there about a covered drug. And a covered, any prescription drug that a covered manufacturer intends to introduce to the market at a wholesale acquisition cost of $10,000 or more for a course of treatment lasting less than 1 month or a 30-day supply, and if you fill out in this or whichever is greater, or is currently marketed with a wholesale acquisition cost more than 100 for a 30-day supply, and the covered manufacturer increases the wholesale acquisition cost at least 20%, including the proposed increase plus cumulative increase over 1 calendar year prior to the date of the proposed increase, or 50%, including is the same jargon right there about increase over a calendar year for the prior proposed, over 3 calendar years prior to the date of the proposed increase. So I know it's a little confusing. It's me trying to paraphrase the definition. The actual text of the definitions you will find in the RCW. Next slide. Qualifying price increase is an increase in the wholesale acquisition cost of a drug that's currently on the market with a wholesale acquisition cost more than $100 for a 30-day supply, and the covered manufacturer increases the wholesale acquisition cost. And it goes into the same kind of methodologies that you see in the other definitions. Next slide. So now we've looked at a lot of just the basic definitions of what these terms mean, just about foundational fees. There's manufacturer reporting requirements. As we've seen in House Bill 1224 and the resulting law, each section, whether you are a pharmacy benefit manager, a manufacturer, and so on and so forth, all have different reporting requirements. I pulled out of the law for you today, the ones that apply to manufacturers, okay? So it requires that manufacturers, covered manufacturers, to submit the following data for each covered drug. It's a description of the factors used to set or increase wholesale acquisition cost of the drug, the patent expiration date of the drug if applicable, and the multi-source or single-source status of the covered drug. And I think if you look at the actual text of the law, it's a little bit more specific. I was summarizing at a little higher level for purposes of slide deck. Next slide. I think there's going to be 8 of these, so we're on number 4 now, so it's following along. An itemized cost for the production and sale, including annual manufacturing costs, research and development, total cost for acquisition of the drug, so on and so forth. You can look that up yourself. Number 5, the total financial assistance given by the manufacturer through assistance programs, rebates, and coupons. For all qualifying price increases of existing drugs, the covered manufacturer must submit the year the drug was introduced to the market and the wholesale acquisition cost at the time of introduction into the market, right? Next, the covered manufacturers have to report for price increases of drugs manufactured for the previous 5 years or more, must submit the schedule of the wholesale acquisition cost increase for the drug for the previous 5 years. Number of reporting requirements. There's another one. Next slide. If the manufacturer acquired a drug within the previous 5 years, it must submit the wholesale acquisition cost of the drug at the time of acquisition and in the calendar year prior to acquisition, and the name of the company in which the drug was acquired, the date, the purchase price. And generally, covered manufacturers must submit this information as well. Now, these 60 days in advance of the qualifying price increase for a covered drug, and within 30 days of release of a new covered drug. So they have to report information about drugs in that time frame as well, if there's new drugs coming on. In addition, covered manufacturers must provide a notice of a new drug application. So manufacturers must inform HCA that filed with the Federal Food and Drug Administration a new drug application or biologic license application for pipeline drugs or biologics in the license application for the biologic product. It must be filed within 60 days of the manufacturer receiving the applicable FDA approval date, and HCA may request the following: the primary disease condition or therapeutic area studied in connection with the new drug, clinical trial comparators, and the date at which FDA must complete the review of the drug application. Next slide. HCA may request the following: the primary disease condition or therapeutic area studied in connection with the new drug, the clinical trial comparator of the drug, the date at which the FDA must complete its review of the drug application, and if the FDA has designated the drug for an accelerated approval, the priority of review, and if the drug contains a new molecular entity. Right? Okay, next slide. I tried. Notice of the price increase. A manufacturer of a covered drug must notify HCA of a qualifying price increase at least 60 days prior to the planned effective date of the drug increase, including the date of the increase, the current wholesale acquisition cost, the dollar amount of the future increase, and a statement regarding whether a change or improvement in the drug necessitated the price increase. If so, the manufacturer shall describe the change or improvement. And if a drug is approved within 60 days of the program implementation date, the submission must be made as soon as possible, no later than the effective date. Next slide. So HCA must do stuff with the great data and information that we receive from manufacturers. And so the law requires that the healthcare authority compile and analyze the data, and that the healthcare authority prepare an annual report for the public and the legislature, synthesizing the data to demonstrate the overall impact that drug cost rebate and other discounts on healthcare premiums. And then HCA must make recommendations on how to provide advance notice of price increases to purchasers in Washington State. Next slide. And then HCA has an enforcement duty under the law. HCA may assess a fine up to $1,000 per day for failure to comply with the requirements of the law. And that money goes into the Medicaid fraud penalty account. We are in the process of creating a process for enforcement through rulemaking, and that's kind of why you're here today, is we wanted to get your information as we do the rulemaking. And it's going to be in compliance with RCW 3405 for the rulemaking process, as well as any enforcement process. So in RCW Chapter 3405, it sets forth APA, Administrative Procedure Act, adjudication. And we want to make sure that we set up a fair enforcement process, and we have a good way to manage disputes, right, to get to fair outcomes. And so we're going to be talking a little bit about that today, too. Now back, one more, back one slide. Don't forget, So these are our key components of implementation. They really shouldn't be a surprise to you because you're in the business, right? We got to communicate this well. We're going to do rulemaking. We're doing stakeholdering. We have to develop a compliance or enforcement program. And most importantly, we've got to implement a program that allows us to collect data in a way that you can submit it, for us to be able to store, analyze, and use that data, and able to do the analysis the law requires us to do. So there's definitely a throughput issue here. If you're required to give us data, and we're required to do something, the system needs to work for all the partners involved. And that's why you're here today. We really want to be able to ensure that we get this right, so that the parties that are involved in this business process have a voice into it and how it's deployed. And then we have the report that we also have to do. Next slide. I'm fearful of saying, do you guys have any questions before we get to this piece? But you might have a whole bunch of questions I can't answer. But I'm going to pause and do that anyways. I've said a lot. I am not a drug price expert myself. But do you have any initial questions based on what I've said so far that you think I said something wrong, you want clarification? All right. So I'm 80% good at least. What I strive for. So the rulemaking schedule for folks following along online, we've already filed with our CR 101. This is a document that we file with the Washington State Code Revisor Office that initiates rulemaking. And that's already been filed. The initial process has begun. We're holding stakeholder meetings between February and April. We've targeted audiences. Today's drug manufacturers. We have other audiences that are targeted. It is not for other sessions. It does not preclude your participation in other sessions. We just wanted to have a focus for the different types of stakeholders or partners involved in the process to have their own voice heard on their particular needs. So I think we have one specifically to PDMs, pharmacy benefit managers, carriers, and manufacturers, right? I think with our PBM session, we're doing that with the pharmacy benefit ASO type of organizations. So we anticipate that we're going to release the draft rule for external review on or about June 8th. We are going to file our CR 102 on or about July 22nd. We will have a public hearing on August 25th. I doubt that date's going to change because I'm very confident that we're going to hit all these milestones. And then the rule should be effective on October 16th. And so we know that that's a pretty aggressive rulemaking time frame for something this big. And that's why we really want to be able to hear from you today about what worries you about this program. Next slide.
Can I ask a question about that?
Yes.
One.
Can we get the microphone for you just so people on the phone can hear?
That's the last one.
One regulation package or that regulation package that's where we see that schedule applied specifically to the manufacturers?
We are creating a whole chapter of rules, and it's all be done at the same time for all of the entire program.
Thank you.
Yeah.
I have one question for the phone here. Can you hear me? Okay, so Natalie Cardenas asked, will there be multiple stakeholder meetings for manufacturers beyond this meeting?
No, we don't have those scheduled, but you're welcome to attend the others as well, and you're also welcome to reach out to us informally as well as formally through the public hearing process and the external review process on the rulemaking. So there's going to be multiple opportunities, but we only have one specifically scheduled for manufacturers.
Can I have a follow-up? So they're a little bit different with regard to a little bit different nuance. Any type of public work session, whether it be specific to manufacturers or all three entities, that any public work session on the regulations on the draft.
Not scheduled at this time. Totally interested in your input, although that was useful.
Okay, then one more follow-up.
Yeah.
If you not made the decision potentially on a work session, have you considered creating any advisory groups in case you have questions as you're moving forward so that people can respond to perhaps whatever it is that you're struggling with?
No, I don't think we'll have time to assemble an advisory group, but I would look towards what other possible ways we could achieve that need to ensure that we do this well. So I don't think, just on Stakeholder, I don't think we're going to have time to stand up an advisory group with the schedule. But I'm open to hearing recommendations and suggestions on how we can accomplish really good stakeholder embedding of the process. Yeah.
Yeah, just a follow-up onto that previous question, just because the timeline between June 8th and July 22nd for sort of formal ability to get official review once the language is actually being distributed. And I understand that once the CR 102 is out, there'll be a public hearing, but we also know that between that sort of that preview draft and it being finalized in the CR 102, it's an important time for the agency to get feedback from all the various stakeholders. So just interested to see sort of what develops between now and then on how you are going to be receiving comments and then how you're going to be responding to the stakeholders. And then the other just quick thing I have, it's small, but I see that the effective date is October 16th, and I think the original legislation, as in a bill that's currently working its way through the process, is October 1. So I was just curious if you could explain why the 16th. Is it strictly a timing issue?
It's a timing issue. We're unable with the current time frame versus when we have to file things with the Code Revisor's Office versus doing the public hearing until the August 25th. And to allow the stakeholdering that we would like to do. It's a timing issue. So it's a student need to pick up.
And Donna, can you both introduce yourself?
So your name and what company you represent?
My name is Donna Stewart. I'm with Pharma.
Eric Lomas, Johnson & Johnson.
Awesome. And thank you. So with the external review process, so if you sign up, you'll see the slide at the end on how to sign up for the rulemaking notices. If you sign up for the rulemaking notices, you'll get the non-official draft rule for the external review process. We will submit it to you. You'll have an opportunity to give us as many comments as you would like. Then we incorporate all the feedback. Then we'll be able to respond to that at that stage. When we do the CR 102 stage, then it's a more formal document, and then there's an opportunity to give formal comments at that point, either in writing or by showing up at the public hearing to testify at it. And we take all those comments equally as seriously. So there's two opportunities to review the draft rules and provide comments. One is informal through the external review phase, and then one is formal in the CR 102 phase, public hearing and that. If we as we go through this, determine that there's a need for more rounds of review with the stakeholders, we'll announce it to all the stakeholder parties and give you an updated schedule. So if there's a more iteration that we need in the two-step process right there, then we're going to go ahead and we'll share that across. And so I got to talk to my team about that, pull a couple more stakeholder discussions, understand a little bit more, and then also see how things develop. So I can't make promises today on that, but I heard you. Thank you. Any other questions? And then, Donna Sullivan, is in the room as well, and she was just a friend. She is our chief pharmacy officer. I don't know if you've ever met her before, but she's very proud to be here today to be working with you. All right, next slide. So here are some steps that the project team wants to know, or me, drug manufacturers. We want to know what do you need from us to be successful to provide the required information and data. Is there a state, we know that there's other states doing this work, is there a state that's doing this right that we should be looking at and modeling? What are you looking for in fair enforcement? I mean, I would imagine you wouldn't like it if I published a rule that says any violation of any fine is going to be $1,000 a day, right? That's probably not going to go over well with any stakeholder. So what's a fair fine structure or penalty structure, knowing that each state has the discretion to do $1,000 per day for any fine for section 389 of the bill or whatever it says, right? It's quite broad there. We have some meaty stuff that we're training that. What's a fair process for enforcement? What's a fair penalty or fine structure? Is there certain states that are doing this well that we think you should model after? And then anything else that you think we need to know? I mean, the group is building submission guides, right? We're building information. We have a lot of work that we want to do to give all of the parties involved, all the stakeholder groups involved, an opportunity to be very successful in submitting data. But we don't know what your internal constraints are for how to submit, or problems that you might be experiencing in other states. We would love to hear that. This is just 4 prompt questions. We're very interested in any other things you'd like to have us consider while we work towards getting that draft rule ready for you to look at. With that, did anybody sign up with formal comments? Yes, we do have some. Okay.
Is this on? Okay. So the other thing that I want to just point out why we're asking for this information is we realize there's many states now that are going down this road, and to the extent that we can ask for the same information in the same format as other states so that you aren't having to do this 50 different ways for each state that's doing that. So that's really why we would like your feedback and any suggestions on other states that have already implemented this that we might be able to model after. It'll make it easier for us as well as we're not trying to recreate the wheel.
Okay, so Donna Stewart has signed up and she'll be our first speaker, and you can come up or we can give you a mic, whatever you're more comfortable with.
I might come up so that my back's not to people.
Very good.
Okay.
I'm going to sit down because I can't listen.
No worries, no worries. And I'm almost tempted to say that it might be good to couch my comments according to some of these questions, because prior to coming today, without a draft to respond to, we weren't really sure exactly what it is that you were going to be focusing on, and what you might ask. So it would have been helpful to have those ahead of time. But even though we didn't, there are a number of issues that you are touching on that we are very concerned about. And we spoke to these as the bill was happening and went through the legislative process. So some of them, you're going to be familiar with, but they do bump up with what we consider might be a fair enforcement process, and then also what may be fair from our end as you are receiving this data, interpreting it, and then reporting it out. And that's probably where I think I would like to start. As you begin going through this process, we continue to have some very significant concerns related to the proprietary information disclosure. From basically you're going to be receiving our trade secrets, and the care and protection of that information is a great concern to all of our members. That is one of the primary reasons why, we are very skeptical about how you can move forward in a approach potentially and not expose, some of our, trade secrets. In particular, I'll point to Section 10 of the bill, in which it allows for the dissemination of information to the legislature. And as that information gets sent to the legislature, there really are no protections or restrictions on, number one, who can make the request, why they are making the request, and then what they intend to do with that information. And that's a significant concern, because once it leaves your hands, there isn't that same, well, I'm not sure what your internal process is, but there really are no parameters around what may happen to that information. And you are receiving the information in response to a legislative directive to, create a report, take a look at what's happening with those prices. But there could be any type of request from the legislature. It doesn't matter what, they might even just be curious what's going on with this price. So we ask that as you go through this process and you are considering these regulations, that you keep that in mind, and if you can have influence over how that information, what those types of requests would be, how that information might be protected from your end, that would go a long way to helping ease our anxiety about how that would move forward. The other concern that we have that is very specific to what your charge is, in fact, it's called right out, you need to make recommendations for how you're going to release this information. And the trade secret proprietary information, that part aside, there are some very real consequences that could happen within the market disruption if information is released to the public. And, there could be some situations in which we may find that a distributor, sees that there is going to be a price increase for 60 days out when that has been, reported. If you report it publicly, they could, potentially hoard medication at a lower price, and then in the future, 90 days later, 120 days later, sell it at the higher price. Now, that is a strategy that a number of businesses may, utilize in other industries. But what could happen with regard to pharmaceuticals is that there becomes a shortage of that medication. And so we then have a direct impact on our patients that need to utilize that information. So as you move forward in that, that's another area where we encourage you to exercise caution, and it's one in which we will be very carefully evaluating the approaches that you're going to be taking. One of the reasons why I am curious about, and if you can build in public work sessions or advisory groups, I recognize that you've got a timeline that you must stick to, but there are some very practical implications for patients that we really need to be thoughtful and methodical about as we move forward. Similar issues I'm sure that you have heard in other arenas, but with such a compressed timeline that you put out, there's more opportunity for us to have disruption in the market than maybe we would have had in other situations. So with that, I would like to ask a question in the sense that it would be great if I could have some time representing the Pharmaceutical Manufacturers Research Organization. If I could have some time potentially to ask our members some of these questions, because I would have been more prepared if we would have had them ahead of time, but no worries. But if we could have some time basically to consider these and perhaps provide you with more formal comments, because I think we have some tremendous a tremendous opportunity to help inform beyond what I have shared with you today. Now, there's two other items. Do you want me to finish or do you want to ask a question?
No, I was going to respond to that. We will make these slides available on the website, and also at the end of the slides there is an email address that you can submit any comments to, that you can share with your members to submit any information to the mailbox, and then we'll be able to take that into consideration as we're building the rules.
Great, thank you.
This is Annette, just one word to share us all. Intention is we want to stakeholder well, we want it to be an iterative process. What you say today isn't going to lock you into, you shall not speak again. So we want you to be able to feel comfortable in providing. So take the slides back, talk to people you need to, send us in information, pick up the phone and give me a call, whatever works for you, okay?
So the other two areas that I wanted to make sure get brought forward today, one, you've already gone through the extensive list of items that have to be reported. And we recognize that those are each spelled out in the law, and those are the maximum number of items that we're expecting at this point to need to submit. And so I want to just exercise that caution that And we feel very strongly that that's a lot of information that needs to be produced. It's going to be costly to produce it. It's going to take a lot of analysis on your end. So we, no further requests or requests beyond what are currently in there. And then just on the practical terms for implementation in general, response timelines. We've seen a number of different, you mentioned other states and what they may be doing in other states. And we've seen some kind of, I would say, fuzzy language in other states that say manufacturers must respond timely or they must respond promptly. That does not set a very clear expectation for when that information would be submitted to you, or depending on that volume of information, doesn't even necessarily, reflect how long it might take just to pull it together if we were, working so many hours per week to get it together. And so we do ask for a set timeline. We would prefer to see something along the lines that any request for additional information we do provided within 90 days of when that request has made. And then the reverse also is that you are going to ask question about something that has been submitted, that you do that of the manufacturer within 90 days of receiving the information that has been sent to you. And that way we will have a more clear expectations and avoid some of the other issues that you have asked about with regard to penalties. So with that, I may have other questions as we go on, but that really kind of concludes the remarks that we had hoped, to be able to share today. Again, not knowing what questions you might ask, and then not necessarily having a draft that we can respond to.
Before you go, for the people on the phone, I got a request if you could just state your name and your organization again, and for any speaker.
Yes. My name is Donna Stewart, and I'm with the Farmer.
Thank you.
Donna, it's from the Lions Net again. Donna, I really appreciate your comments. I want to just ask, does anybody else want to share some information along the lines with the prompt questions or anything else you want to share with us? The lesson learned from me immediately is I have 2 more stakeholdering sessions. I'm going to distribute the questions in advance. So I heard that here. So I think that's a good improvement. But is there anybody else who wants to either take the mic?
I have someone on the phone.
You have someone on the phone. Go for it.
Okay. Katie Lappin, I'm going to unmute you. Can you go ahead and talk? We should be able to hear you now.
Yes, my question is, will you be actually providing an email address for us to submit questions? There are a number of areas where we would like clarity, such as the example I submitted was California and a couple other states say that an acquired product is a new drug, but Washington's saying it's an existing drug. So things such as that require a lot more than just, hey, how do we do this?
So in the room, on this mic I was flipped the slide deck over to how to email us. We have an email box set up just for this program. Any questions you have or communication, send right there so we don't lose it in our individual email boxes. And again, you're welcome to call me. I'll talk to anybody. And you don't have that information on there. I'll just tell you 360-725-1254. You're welcome to call me anytime you want to talk about it. But we would prefer to get the emails back to transparency@hca.law.gov. That way we don't lose questions, comments, or concerns as we go through the process.
Thank you.
And if anybody else on the phone could speak, if you could just either raise your hand or put something in the question box.
If we could toggle back to the slide that I skipped. This is the slide for those on the phone. You should be able to see it now. This is how you sign up for rulemaking notices. If you do that, then you will get notice of the external review draft, which is the first release of the draft rule. And so I really strongly encourage you to go back and sign up for the rulemaking notices, okay? And it's pretty simple. You go right onto that link, and there's a way to sign up to get all the official rulemaking notices about this project.
And this is Donna, so I just want to reiterate, even if you signed up for the Gov delivery or the drug transparency communications, you also have to sign up for the rulemaking. It is a completely separate process. So just because you signed up for Gov Delivery for the drug transparency information doesn't mean you'll get the rulemaking information. So it is two different processes.
It's super important.
I have one more person online. So I mixed this one. Nick Olivares said, an easy-to-use online portal with clear directions is always good. Having a comprehensive, frequently asked question with detailed examples is great as well.
I agree. Pretty awesome. I was looking at Oregon's portal. Is that a model? If you do it silently, no one's going to know you did it. Tell me, is that a model?
For submission of information. This is James Matucci with Merck. We have found the portal to be poorly under-designed in the sense that it's hard to provide information. It's hard to, when there's, what's the way to put it? It's hard to provide information when that information isn't available. You can't leave things blank. Mechanics of the portal itself are evolving. I appreciate that. But we have had to go back and forth a few times, partly because some of it doesn't apply specifically to us, or there's not a narrative, a place for narrative available to explain the information you're giving, so that, you know, as a lot of companies, we're more a law firm than the drug business. Our attorneys can be concerned with some of the information needing the narrative so that it can be as accurate as possible to make everything compliant with the statute, but the narrative space is not available. Except, as I recall, at the very bottom of it. So it's hard to refer back and forth. It's just cumbersome in that respect. To the extent that you can have those fields be more interactive or wider or slightly bit more detailed.
I highly suspect year one, Moves Portal will exist. With leveling expectations, right? You see our time frame that we're working with. But future state, you know, getting to a functioning portal would be so great. And so I really appreciate your comments, because that helps us so that we think about a long-term, having a nice, easy-to-use system to submit, which I doubt will happen by October. It's going to be really important to ensure that we do that piece right for long-term strategy.
And so, however, we are expecting to have some sort of specification to say there's different fields that these need to be numbers, these need to be letters, that will be specific format you'll have to submit it in. But it's going to be more like in a file, like a one Excel spreadsheet or comma delimited file, something like that. But what I hear is that there needs to be a section where you can put, you know, maybe not 100 pages of text, but some additional text above and beyond, like 100 characters or something like that.
Yeah, the Oregon portal is one box at the end, unless it's changed recently. Unless it's changed recently, then somebody in the room can correct me, but it's one box at the end for narrative that's sort of global for everything above it versus being able to speak specifically item by item. And I think one thing also to consider that companies in the industry are varying size and have multiple markets around the world, so the information that we collect can look differently if you're a strictly domestic company or if you're like Merck with multiple international markets, multiple markets within those individual companies or countries rather. So the standardization can be complicated for a company that has broader reach.
I've got two comments online. So Anthony Adams said, will you allow third-party providers to submit for multiple clients? If so, can this be done with just a single login with access to all of their clients?
Not designed yet.
Not designed yet. Okay, something to consider. And then Katie Lappin said the Oregon portal does not allow for importing a file. That would be much better than entering data.
That's a great comment. Appreciate it.
So my name is Barbara Morrow, with Dallas Pharmaceuticals. So my question is going to be, if a portal is not established by October, Can you give a little can you elaborate on how exactly the info is to be submitted? Is it to just go to a web, to email? Okay.
I was going to. So this is Donna. We're talking about different opportunities. One would be that you would submit a file of some sort to a particular email address. There's size issues that we have to worry about then. So we're trying to keep that in mind. And then we would build some sort of automated process to extract those files and then consume those files and get them into our data warehouse that we're trying to build. So that's kind of everything that we're trying to think of is we're trying to build it in a way that if we migrate to a portal in the future, we won't have to redo the data templates as well. So we're trying to keep that all in mind. But because we have such short time, a lot of this we have to get decided before we do the rules. So we're trying not to over-engineer it up front and allow us time to make changes over time.
So another concern we have in the Oregon portal is that the effort to separate proprietary information, trade secret information, from non-trade secret designated information goes through the same channel, and it's unclear how they're separated to avoid any sort of incidental disclosure in the process. They go through the same channel. I think, somebody correct me if I'm wrong in Oregon, this has changed recently, but they're also handled by the same staff. So the ability to have something incidentally disclosed before it's been resolved as trade secret through the dispute process is a very real concern. I can speak during my own experience at a previous company in Washington State, long before Donna or anybody else in this room was here. That supplemental rebate contract was disclosed. So these are very real concerns, and unless they're through separate channels, handled by different staff people, who turn keys differently, if you will, that's something we have great concern about.
Let me paraphrase. Internal firewalls to help protect the integrity of the data, help defend from inappropriate releases or misuse of the information. Is that right?
Yes.
Got it. Thank you.
Well, as we have this conversation, my mind is just going in that direction as well, is I think if a manufacturer designates something as proprietary and the department doesn't think it is, that's what the dispute process is about. I get that. Well, we, the manufacturing community, does. But I think there's got to be a way that the manufacturer can declare at the time of submitting, this is proprietary, this is not. So that separateness that James is talking about, even if it's maybe two submissions to two different locations, I don't know, but something where in advance the department knows what the manufacturer thinks is proprietary, recognizing that the department might come back and say, well, wait, we don't think that is. So that subpart, if you will, could be what the dispute process discussion.
So just in response to that, one of the things that Annette didn't go over, but if you go back to that slide that had kind of the boxes on it, one piece of what we'll be developing is data governance. And that includes who has access to the data, who can we disclose it to, you know, is it category 1 data, is it category 2, 3, 4? It's not protected health information, but it's proprietary data. So part of the storage process will be saying not everybody is going to have an app where they can just pull it up on their phone and look at all the data. There are going to be particular people that are allowed to get into the data and do the reporting. So we hear what you're saying about the proprietary nature, and there will be certain security levels. Certain people will have access to everything, other people won't have access, maybe just summary level data, and there will be many people, and then, you know, most of the people in the organization won't have access to it at all. You know.
I'm loving the conversation. We still have time. this is an opportunity to tell us whatever you want to tell us. Is there anybody else that has any other comments? So much meaty stuff there. What do you guys think? Should I fine you $1,000 a day for your first mess up? Does that sound like a good, fair, fun enforcement process? Yeah. Do you want an impartial judge to be hearing those cases? Yeah. Yeah, you do. I know you do.
I would have one of our experiences out of Oregon is the James Institute is that eventually these reports across the country, with states passing them anyway, will become standardized and easier to comply with. But I would ask for your indulgence early on with a large company such as Merck. I don't think the states oftentimes appreciate the churn involved in generating this information. It's a lot more complicated than just getting a price point in a particular market outside the United States. It can be very, very difficult to get that information. Even within our own company, it can be very difficult. Not as a stalling tactic, I promise you, just as a complicated matter within business units. Second, it can be difficult really to make sure the information is provided to you in the format you're requesting in such a way that we also believe that we're in compliance. I don't think we would release the information if we didn't think it was in compliance, and we don't want to give it to you late because it'll be out of compliance.
Right.
So as you go through this first iteration or two, some patience involved on both sides, I think, is well recommended.
I hear you.
Dennis, do you have something to say?
No, I was just coming up here so that Archie doesn't have to run back.
Any more comments or questions on from the webinar? I know our team, we've got a strong data team who's assigned to this project, and they're very interested in setting up a process. You'll find it in probably submission guides more than the regulations itself, but they want to be able to develop some submission guides to give really good instructions that are easy to understand, that fulfill the call of the law that you can do. And what they wanted me to get from you today, our data team, is what does that look like for you? And I know without the prompt questions, you may not be able to answer that, but if you have thoughts, share them today. If not, I would love to learn more because we want to be successful. We don't want to create additional administrative burdens for you. We certainly don't want them for ourselves. We want to try to set it up in a way, knowing that year one, is the first phase of implementation. It's us trying to meet our legislative mandate. We might be behind if you've read the past law. So we're trying to get it right, and we really want your information to help us be successful.
This is so one of the ideas too is, NASHB has come out with some templates. They're trying to kind of coordinate a national template. Feedback on is that the right template would be also helpful. We are looking at other states like Maine, Connecticut, Vermont, Oregon, Nevada, or just a few that I can rattle off. So if there's some of those other states out there that are already implemented, comments on what they've done good or bad would be really helpful.
That'd be really cool if we did the best, especially with our accelerated timeframe. All right.
So this is Eric Owens with Johnson Johnson. I just wanted to state, I don't need to tell you this is obviously a very complicated issue, and there's a number of different variables that need to be considered. So viewing this meeting is sort of preliminary. How are you viewing this task? I think we'll walk away from this with a better idea of where you are at, the types of questions that you want answered. And I know that the industry and I can't speak for other companies, but individual companies will give you the feedback you need. But please don't hesitate to reach out to us as very specific things come up.
Thank you. Anything else?
Just want to confirm that you will send out the site questions, and that we will have an opportunity then to continue to submit a comment prior to even the release of the draft regulations. just want to confirm that.
I appreciate that, thank you. And then to the first stakeholder group, I'd also be interested in understanding whether or not you guys would want a round two before external review. Since you're on the tip of the iceberg, the tip of the spear, you're cutting the path for the other stakeholder partners who are implicated with our Washington state laws that exist. I'm open to discussing whether or not we circle back with this group for another in-person session.
I'll respond and say yes.
We're testing it out on you before we go to the others, so we'll see what works well with us.
And I'll respond in the affirmative as well, just particularly since by volume of bill, our industry is disproportionately impacted. The tally of all the various sections and words. I think it makes sense for us to have another go at this now that we have a sense of how you're approaching the problem.
Was it useful at all from restating and paraphrasing all of the legal requirements for you today and going through and reading all of that, or was that a waste of all of our time? Let's out there right now. Tell me what works well and what doesn't work well so I can do better for next year.
I would say, many of us that are in the room, I can't speak for all, but that are part of the manufacturing community are lobbyists, and we were here last year, so I can say within my company, I have a much better understanding of 1224 than others. Okay, so in that sense, I do though understand as it being the first stakeholder meeting and a review of what it is you're looking for, that not what you're looking for, what you're being required to ask through the law. I get it. If we have a follow-up meeting with the manufacturers, I don't think it would be you guys, the review of the law itself. Yeah.
Okay. I'm going to ask this because you guys know the field well. We've got PDMs coming up, as well as carriers. Do you think that they would benefit for a quick refresher of 1224, or could we cut that out for those groups?
Well, this is Donna from Pharma, and my response to Barbara's comments may help with this. I think from my perspective, listening to you and seeing what you had on the slide helps me feel more confident that you were on the same page with regard to the important points within that bill and what the task was. And so I would assume that the other stakeholders would appreciate that opportunity as well. So I did think it was beneficial. Like I said, it helped to ease my concern about, what the approach might be and your understanding of what is required, and I imagine that they would do that as well.
This is Eric again. And I'll just say, you all have obviously put a lot of thought into this bill as it passed last year, and you're contemplating this effective date towards the end of this year. So to the extent that you're framing the discussion by going over the requirements of the bill, you've no doubt already come up with questions of your own. So maybe if you were to include in those sections 2 or 3, and for our follow-up meeting as well, perhaps, 2 or 3 questions that you would like particularly specific insight into, I think that would be a good way to help you all frame the discussion.
Great, thank you, because you guys really were the cutting group. Any other questions also you guys want to give me
One on the
on the phone of things you can do better or things you'd like to see?
Yeah, so this is Michelle, sorry if I mangled that, asked, will the guide provide clear definitions for each of the items being requested? The law is vague regarding items such as RD costs, for example, scope.
Ooh, that's a great comment. Yes, our hopes, desires, and intention is to be able to put out a submission guide that is so clear and easy to understand that addresses all of those. That's our intention to help. So things you get to do to help us is tell us when we're getting it wrong. And identifying topics like that one, where having the definitions there in our WAC, but I'm not going to do regulations. You're doing what we call WAC, and it's the same as we'll talk. In my world, a WAC is a regulation in Washington State, right? The Washington Administrative Code provision. I'm not going to promulgate regulations redefining what's already in our Washington Code. But things that are not defined in our Washington Code that for us providing you a definition be helpful, let me know. Otherwise, we'll define it in the submission guide. That's another kind of take back. If there's things that aren't defined in law, but you see it in the bill where there's an opportunity to influence the definition, provide recommendations to your opportunity to influence.
So this is, so I think what we'll be doing is describing how we're going to implement it. One of the things we're not going to do is define all of the data specifications in the Washington Administrative Code, the WAC, because that requires this whole regulatory process to change it. So we will be really relying heavily on the submission guide that we can kind of change on the fly based on feedback that we receive from all of the stakeholders throughout the program, and make updates kind of on the fly as we're learning what's working and what doesn't work.
So the yes and.
Yeah.
Other thoughts? Other things we can do that are useful, helpful, or things you don't want us to do that are not helpful. Please don't do this HCA. Besides implementing the bill, if you're not saying nothing. But yeah, I don't have a choice. I've got regulations. I've got law that applies to me. I got to do something. I've got to implement it. But it's like, is there anything you would like to see us do or not do?
This is Sterling Farm again, and back to one of my original comments. We are very concerned and remain concerned about the release of information to the legislature. Yeah. And if there is any way that you can influence the withhold of that information until those sections within the law get appropriately revised so that we can protect that information, we would appreciate you being able to have influence in that particular area. Now, we understand there are some challenges with doing that, but to the extent that you can influence the withhold of information on legislative requests until that gets taken care of, we would appreciate it.
So I have a question for you. I'm out of line, let me know. So there's a bill floating out there to amend this current regulation. We made changes to the disclosure piece. Is that not sufficient? Is there concerns you have on that additional information that you would, what else would you like to see in that would be helpful?
This is Donna Stewart again, and Donna, I appreciate you asking that question because you actually expanded the number of individuals that can have access to the information in the bill, so we do oppose that. In addition to extending it, to additional individuals within the legislature, also to the governor's office and to the Office of Financial Management. And so, we're very concerned because there are no parameters for what they may be looking for when they request the information, and then no real restrictions on what the use can be. So, we have some very great concerns.
Okay. That's actually good feedback because we thought we were reducing.
Our intention was actually to try to help
be more prescriptive of who can get the information as opposed to anybody in the legislature.
Yeah. No, I'm sorry, we read it as a pretty significant extension.
Okay. Are there, and yeah, this is off topic with the rulemaking itself, but are there existing work groups going on with the governor's office or anything right now addressing your concerns on the active bill? Is there a forum? Anybody else? All right, well, we are done 25 minutes early today. I really appreciate those of you who came out in person. I also appreciate the folks who dialed in via the webinar. We will make the materials available to you. I gave you guys all my direct lines, right? 360-725-1254. Debbie will answer it tonight. I'm happy to talk to anybody and really learn what your concerns. And I think our goals are aligned that we want to be able to be successful, whatever legal obligations we have. And so we're partners in that. We're very that all of us want to be successful, right? So we want to be able to launch it in a successful way. With that, thank you so much for coming down today, whether you came down from Seattle or flew in from out of state. And thank you for those on the webinar.